I'm Kevin Baker, the Programme Coordinator at Malaria Consortium, responsible for the ARIDA project globally.
Hi, I'm Charlotte Ward. I'm the Senior Research Officer at Malaria Consortium, and I work on the design, supporting the management and the data collection and analysis of the ARIDA data.
I'm Alice Morel. I'm the Senior Programme Officer at Malaria Consortium, responsible for the day-to-day management of the ARIDA programme in Nepal and Ethiopia.
My name's Helen Smith. I'm a Research Specialist at Malaria Consortium, and my role in ARIDA has been helping to design the qualitative component of the acceptability study. I also trained the data collectors in Ethiopia on interview technique and also analysed the qualitative data.
Sure. So ARIDA is a 3-year project funded by the Caixa Foundation in partnership with UNICEF, where Malaria Consortium are testing 2 diagnostic tools in 2 countries for acceptability. The first device is the Philips Charm device, which is an automated respiratory rate counter, and the second device is from Massimo. It's called the RAD-G, and it's a multimodal device which measures oxygen saturation and respiratory rate. The project is being implemented in Ethiopia and Nepal, and both of the countries were selected for a number of reasons. One, because they have a high pneumonia burden, and also because they have functioning community health worker programs in place in both countries. The priority is to finish data collection in both Ethiopia and Nepal by the end of December, and then very quickly to analyse the data and disseminate the findings by the end of March in 2019. We've got stakeholders at a number of different levels interested in the findings from the ARIDA project. First and foremost, at a national level in both Ethiopia and Nepal, we'll be focused on disseminating the findings to Ministry of Health, as well as national stakeholders who are implementing community health worker programs in country. We're also focused on disseminating the findings for manufacturers, the current manufacturers Philips and Massimo, and also potential new manufacturers of automated diagnostic aids for pneumonia. And finally, other implementing organisations and academics who are interested in understanding how best to evaluate these types of devices. Dissemination will also happen on a global level, where we will be disseminating the findings to multilateral organisations and WHO and other interesting parties working on new diagnostic tools. We are committed to continuing to develop the evidence base for new diagnostic tools in pneumonia, and look forward to testing the next generation of devices, including pulse oximeters and multimodal devices.
One of the highlights for me has been having a look at the results from the acceptability study in Ethiopia and seeing that a very high number of health extension workers can adhere to guidelines to use the Charm device in their day-to-day routine.
So for me, one of the highlights of the project has been identifying the findings from the qualitative component, and some really interesting things have come out of that data. One for me is that caregivers just unconditionally accepted the device and were totally happy for it to be used on their young children. And even if the child was distressed having the device attached, then the parents just said, look, my child's distressed, they're ill, this is fine. So there's this unconditional acceptance of the device among the caregivers. From the health workers' perspective, what was interesting is that yes, they accepted the device, they could see the benefits of using it. However, they only really trusted the device and the results after they'd checked it themselves against the previous respiratory rate counters and the other devices that they'd used before.
Having been in the field in both Ethiopia and Nepal, it was amazing to see the device being used in the hands of community health workers and see their positive reaction to how it supported them in